everyone. My first guest today is Dr. Frank Lafranchise, who is a neurologist with St. Thomas, and May is Stroke Awareness Month. So we really want to focus on knowing the symptoms, knowing who's at risk, and what kind of treatments are available, the importance of getting to an emergency room quickly. Every 40 seconds, doctor, someone has a stroke in this country.
It's really amazing. Close to 200,000 people a year die from stroke. Almost 800,000 suffer a stroke each year. It's quite a problem. The good news is that stroke had been the #3 cause of death in the U.S. It's now dropped to #5 because of risk factor identification and treatment and early intervention when someone has an acute stroke. But it's still a major problem, a major health issue across the country and in central Tennessee.
Who is primarily at risk for a stroke? You tend to think of the older population, over 65.
That's true. Older people have a higher risk of stroke, but it's important to remember that 1/3 of all strokes happen in those under age 55. The good news there and the reassuring thing is that even though kids and even infants can suffer a stroke, the prevalence in that group is very low. Maybe 1 in 100,000 to up to 10 in 100,000 depending on the study. But this is mostly a problem for older folks, but it's certainly not unheard of in people under age 55.
Okay, so people that are affected by stroke, what is actually happening in the body? I remember when I did medical reporting them saying it's more like a brain attack versus a heart attack, a brain attack.
You're exactly right. The blood flow to the brain is interrupted, and that's what causes a stroke. That interruption may be permanent or it may be temporary, but it results in damage to tissue. And when brain tissue is damaged, a stroke occurs. There are two main types, depending on how that blood flow is interrupted. On the one hand, the more common type is where the blood vessel is blocked. And that can happen from a clot, from hardened arteries, or other explanations. The other type, which is less common, is where a blood vessel ruptures. And that can happen because of a weakening of the wall of the vessel from birth, and that gets worse over age, or it can happen over time because of the effects of high blood pressure, for instance. So those are the two main types. The type where the blood vessel is blocked happens about 85% of the time. And the type where the blood vessel ruptures, that occurs about 15% of the time.
If you have a rupture, is that harder to treat? It seems like that would be harder to treat than getting rid of a blockage.
Well, yes and no. It really depends on, one, how severe the stroke deficits are to begin with at onset, and how quickly a person gets to the hospital for help. There are treatments, though, for patients with the type of stroke where the blood vessel ruptures. Controlling blood pressure is critical. If the patient happens to be on a blood thinner, we need to reverse that quickly. If the person has an aneurysm, a weakening of the wall, we can fix that, both surgically and through a catheter approach from the groin to the brain without any surgery. So there are definitely treatments, and both types can be associated with very good outcomes if the person gets to the hospital quickly.
Time is of the essence. I know that with stroke and heart attack too.
Yes.
But with stroke, I know there's an acronym that they use. Tell us about that.
Yes, what you want to remember is FAST, F-A-S-T. F stands for face. What you're looking for with all of these is, what is the patient doing, and how do you identify the symptoms and signs of a stroke? With face, or F, you're looking for a drooping of the face. A is arm. You want to ask the person to put the arms out, and if one or both drifts down, that's abnormal. S is for speech. If the speech sounds different or the person can't get words out, that's abnormal. And T is for time. Time to go to the hospital and time to note when the symptoms started.
So are clot-busting drugs used oftentimes if you get someone to the hospital quickly enough? You can administer, I forget what it's called.
It's called TPA.
TPA, okay.
Yes, and TPA has really revolutionized stroke treatment. The interesting thing is that TPA was approved almost 20 years ago, and only now are we really using it to its full effect because patients are getting to us more quickly. And so TPA can improve outcome after a stroke, the more common stroke where the blood vessel is blocked. It has to be given within 3 to 4.5 hours after stroke symptom onset. So not everyone qualifies for that reason, but the earlier you get to the hospital, the more likely it is that we can identify it as a stroke and then treat it with TPA. There is another treatment as well, and that is where the endovascular specialist, a neurosurgeon or a radiologist, can take a catheter, and instead of putting that tube into the heart, he or she moves it to the blood vessels in the brain and can actually grab clot out of the blood vessel, restoring blood flow. That's also a treatment that requires very early, urgent intervention. So the key thing is identify a stroke and get to the hospital quickly.
All right, that's very critical. How can you prevent this from happening in the first place?
Well, that's a great question. There are very clearly identified stroke risk factors. Things like high blood pressure. If we control blood pressure, we can reduce stroke risk significantly. If you're a smoker, stop smoking. And you need help with that. Most people can't do it on their own, but there are proven strategies to help. Living a healthy lifestyle, which includes eating right and exercising regularly. Controlling things like diabetes, cholesterol. Those are all key factors that can all have an effect to lower your stroke risk.
What about, I know this is more abstract, but stress. Does stress play a part? It's hard to measure that.
It is hard to measure it, but what you can see is patients who are under stress, their blood pressure will tend to be higher. They're not going to eat as well. They're not going to sleep as well. They may not attend to their other medical problems as acutely as they should, which can then secondarily lead to increased risk for stroke.
All right. Managing stress is important for your mental health, physical health, everything anyway. So where can our viewers learn more about risk factors, treatment, etc.?
Well, one good place to go is sthealth.com.
sthealth.com,
Yes.
Okay.
And you can go there and go to the stroke portion of it, and you've got lots of good information that you can find there. And then the American Stroke Association and the American Heart Association both have websites that are full of information on stroke, stroke treatment, stroke prevention. So those are some good sources.
Great. All right, Dr. Frank Lafranchise, thank you so much. We packed a lot in a short amount of time.
Happy to be here.
Yeah,
Thanks
thank you
for
very
having me.
much. All right. And we'll be back with a lot more in this program right after this.